Hello everyone, it's good to be back with you again. I trust everyone has had a good summer so far. And to all the educators starting school again, I hope your first few weeks have been exciting and fruitful. Today I'd like to talk with you about women's health. Next week in the San Jose Mercury News, you'll see an article written by me and by Kathy Neer, who is the president and CEO of Planned Parenthood Affiliates of California. I'd like to give you a preview now of what that article addresses. As you know, President Obama recently increased access for millions of women to birth control, breast pumps, and HIV tests in 5 categories of preventative services without co-payments or other out-of-pocket insurance charges. Thanks to Obama, this move softens the blow of cuts to women's services, which we are witnessing in California and in the Republican-controlled House of Representatives and Congress. Thanks to Obama, my daughter and my grandkids now have better access to critical health services. Republican cuts couldn't come at a worse time for women. In the last 20 years, America has doubled its maternal mortality rate. Last year, we ranked 41st in maternal mortality rates, the lowest among all rich world countries. Despite this, Republicans called for deficit reduction deals that would substantially cut Medicare, Medicaid, and Social Security and have a disproportionate impact on the health and economic security of women nationwide. Cuts to Medicare and Medicaid can be debilitating to women and families who rely on these programs to afford preventative and reproductive health services. This is no time to gouge a gaping hole in social safety nets that protect these communities from falling into poverty and poor health. California's cuts are equally devastating. California's budget crisis resulted in cuts to the overall support structure for poor and marginalized communities everywhere. California eliminated state general funds for maternal and child health, and many local governments have followed in their footsteps. Meanwhile, access to health care in California, along with disease rates, continues to worsen for women. For decades, reproductive, maternal health, and preventative health programs for women across the nation have been underfunded, reduced, and eviscerated in the name of budget balancing. To say we do not have the money to protect the health or safety of the women is fallacious and disingenuous. We could save billions of dollars in untouched spending without touching one penny devoted to women and girls' health. We could reduce the $450 million we're spending every day in the wars in Afghanistan and Iraq. We could reap $20 billion in annual savings by closing a tax loophole for hedge fund managers. We could take and rake in $40 billion in annual savings by ending giveaways to oil, gas, and coal industries. We could and should. We know that prevention pays, and that particularly apparent with women's health. An ounce of prevention is worth a pound of cure. It is time to defend women and girls with the same ferocity with which others protect the rich. We better do so quickly before something preventable like our maternal mortality rate gets worse.